Hello and welcome to Digital Mental Health Musings. I'm your host, Tania McMahon, and we're coming to you from Turrbal and Yagara country. Thanks for joining us again if you're a regular listener, and welcome to any new listeners out there. Now, a lot of you might not realise just how long a lot of digital mental health services have been around for. Many of us probably think of digital mental health as a recent development. And while you might say that widespread awareness of it has probably only come about more recently, a lot of key players in the field have already been here a while and have learned a lot in the process about what works, what doesn't work, and how the space has evolved. So I'm really excited today to be able to chat with one of these services, and that's the eHub team from Australian National University, who have created moodgym and eCouch, which are online programs for depression and anxiety and other common mental health problems. So the initial content for moodgym was first scripted way back in 2001, I think. So over 20 years ago now, and eCouch was first created and evaluated over 10 years ago. And both have undergone revision and evolution since then, of course, but these programs have really stood the test of time and learned a great deal in the process. So we're really lucky to be able to chat with them today and hear their insights. So from the eHub team today, we have Dr. Kylie Bennett. Kylie is the Managing Director of eHub Health, which is the ANU spin-off company that now delivers moodgym and eCouch. She previously worked at ANU for 15 years as part of a team which developed and evaluated e-mental health interventions and subsequently led a commercialisation process, resulting in this successful spin-off of eHub Health in 2016. Kylie also has a personal experience of depression and anxiety and is passionate about empowering individuals to manage their mental health through quality and accessible resources. So welcome, Kylie.
Thanks, Tania. It's great to be here.
So to begin, can you tell me the story of eHub? How did it come about? What does it look like today?
Absolutely. And from your introduction, I started to feel very old suddenly, I must say. But the story of eHub does go back, way back. And it really started with two pioneering researchers. So that's Professor Kathy Griffiths and Professor Helen Christensen. So these researchers were basically pioneers in the field that we now take for granted. So back in 1997, in fact, they were authors of some NHMRC clinical guidelines for depression in young people. And it really got them thinking, because part of the clinical guidelines, your listeners won't be surprised to hear, was that CBT was really recommended for young people as a way to treat depression. But the real problem they were grappling with was the fact that there wasn't enough psychologists who had training in CBT to provide these services. There were issues around stigma and particularly in young men, and the reluctance to actually seek help. And also, you know, the thing about Australia is we're such a big country, and the lack of actual accessible resources. So when this newfangled thing called the internet started to emerge, that's when they had the idea of actually overcoming a lot of these barriers to provide CBT en masse. And of course, you know, we take this for granted a lot today, that you can access all sorts of things online, but this was a pretty out there idea back then. And that was when they started work on moodgym back in 2001. And the very early iteration of moodgym was, you know, built on a shoestring. It was pretty unstable, but they actually brought together a team which included technical staff, which was quite an interesting thing to do for a mental health research area within a university. And they actually built the eHub team, which I was a part of. And that team include technical staff, clinicians, mental health researchers that engaged with consumers. Kathy led a consumer research unit as well. And they actually, we started evaluating moodgym in different contexts. And the most amazing thing happened. It was effective. There was a landmark randomized control trial that was published in the British Medical Journal, which showed that it actually was effective. And this kind of started a whole area of ongoing research and collaboration with the moodgym program. So moodgym, there was collaboration all around the world with different research groups from different universities in different countries. And the program slowly developed an evidence base for different settings. So, in universities, in schools, in workplaces, different population groups, and also at different moments in the mental health spectrum. So from prevention to treatment. They also then started to think, okay, well, moodgym was actually created for young people. It was more actually intended as a prevention program. Does this mean we can actually start to think about other mental health disorders and provide training on those? And that's when eCouch actually started to come about. It was first conceptualized in 2005. It was real focus on adults as opposed to young people. And that program actually is a huge program that has more focus on different mental health disorders. And cut a long story short, both programs now have quite a large evidence base. They were continued to be offered and have funding from the Australian Commonwealth Department of Health. This continued in 2016, as you mentioned. I actually led a commercialisation process. The reason being that as a service provider, the university wasn't necessarily the best place to provide services, and eHub Health was spun off to do that service provision. So eHub Health today is a small but mighty team, which includes obviously technical staff, also clinical workforce, and user support team as well.
Wow. So, and that feels so normal these days, doesn't it? Having, mental health clinicians working alongside tech experts. But it's so fascinating that back at the start, going back 15, 20 years ago now, that was really cutting edge. That was really unique and unusual, and a kind of a risky thing to do, I imagine.
Absolutely. Yeah. And it really was the thing that set the eHub team up in a position to be able to then collaborate really widely, to set up administration interfaces to work with researchers who are based in, London or Berlin or elsewhere. And that was something that really wasn't being done at the time. And that was only because of this sort of custom software engineering that was happening specifically for the moodgym program.
Yeah, wow. And so that would have really, being able to collaborate like that really, helps the space evolve very, very quickly and effectively. And I didn't know actually that moodgym started off as sort of targeted at more young people and as a preventative program. I think I've always associated it with, being, useful for adults, and it's that trans diagnostic kind of, mixed depression, anxiety, stress that it seems to target. But isn't that interesting? Then eCouch sounds like it was the 2.0 kind of version, like, oh, we can actually treat specific, if this works, we can actually treat specific disorders.
Absolutely. And it is fascinating because moodgym, if you, a lot of the examples in moodgym are things like, should I continue with the university, or breaking up with your girlfriend or boyfriend? They're quite targeted at younger people. But the really interesting thing is that a huge proportion of our users are aged like 35 and over. And there's great success of the program with older adults. And we'll probably talk about this a little bit more. But one of the big learnings for us has been that there's a general assumption that you need to heavily tailor a program to the specific population group that you're trying to offer the service to. But that isn't necessarily the case. That actually some of the kind of skills and training that you can provide can be quite universal, and that the user has the capacity to think about the kind of skills, particularly in CBT, for their own situation. So yeah, it is actually really interesting.
Isn't that interesting? Yeah, because I think we're moving towards a world where healthcare is very heavily individually tailored, and we can get caught up thinking, we've got to design these programs for this specific audience in mind. But that's such a useful takeaway that people will, people of all backgrounds will find useful things in these programs if they're designed more generally.
Yeah, and I think it really, I think this leads into it when we think about, well, where do eHub programs actually fit in the landscape in Australia? And the answer there is that these are population-wide programs.
Mm.
So they're only one part. I mean, one of the things that, I've heard, I don't hear it nearly as much now, but one of the criticisms about programs like this is you're trying to replace psychologists.
Yeah.
How can you do what a psychologist
Heard
does?
that one more than a few times.
And the answer is absolutely not. Like there's, psychologists are such a vital role. And of course we can't, replace them. There's no intention for that. The point is that at a population level, why shouldn't we all learn skills that can help to actually prevent the onset of mental health problems? When I first learned about CBT, I was like, why didn't someone teach me this when I was 15?
Why was this not in like HPE, at school?
Exactly.
Why is this not part of the basic stuff that we learn?
Exactly. Yes. And that's really the kind of the ethos of eHub health programs. These aren't trying to provide intensive treatment. They're certainly not appropriate for severe symptoms or where somebody needs really tailored support. What they are is offering information and evidence-based information to everyone. It's saying, well, you need to be empowered to make good decisions about how to manage your mental health. You need information. And why shouldn't you learn about different techniques that have evidence base to them? Sometimes you get a criticism, well, is it safe to allow self-help for someone to do that on their own? And my response is, well, is it safe to not offer information at all to someone who may not seek it or access help otherwise?
And I think an analogy that I love is physical health. Is it safe to tell someone to go exercise when they might, to maintain their general health, when, they may go off and, not put that advice into practice, or they may overdo it, or they, may lift some weights that are way too heavy for them. There's obviously risks associated with giving any kind of health advice, but we tell the population to, eat a healthy diet and do exercise and get good sleep to maintain their physical health. And we don't expect those things to cure all the, ailments of the modern day life. But they're like the basics. They're like health basics. And I think, I really agree with you there that these kinds of mental health skills are like psychology, mental health basics. It's almost bordering on unethical for us to not be trying to teach people these things, or make them really easily available and freely available.
Yeah, exactly.
Yeah, before problems emerge.
Yeah, and of course, there's a great study with moodgym that shows it can actually prevent problems. This is with older school children. I shouldn't call them children. I don't think a year 11 would like being called a child, sorry. But the thing is, of course, prevention, it's really hard to get people to do preventative work, right? Nobody wants to do the prevention. We always want the solution after the issues are sort of starting to emerge. So then we're in the sphere of early intervention. And that's exactly where self-help tools can be so powerful. So, when you start to mention, oh, it's just not quite feeling right, this is exactly where a GP can say, without any, need to necessarily create a mental health plan or go into a lot of detail, these are the kind of quality resources that can be easily referred to someone to look into by themselves potentially, and to assess, how it is they really are feeling, and whether there's some techniques that could help them, and also whether they want to take another step and actually reach out and talk to a psychologist, for example.
Yeah, it helps actually clarify that in their minds if they go and do the program and then realize, oh, like this is helpful, but it's really not, going as deeply as I need or as far as I need. I think this is where I go and get face-to-face help. It can kind of facilitate that.
Yeah, and part of the programs have depression and anxiety quizzes, and in the feedback, there's actually a lot of information about how to access other help. So eHub programs don't pretend to be the answer ever. It's always about informing, empowering people. So there's always information about why you might want to see a psychologist, but also what a psychologist can and can't do then. So again, this is all mental health literacy stuff that you're not going to know what kind of professional to seek help from if you don't know anything about what it is you're experiencing or what kind of services they can provide.
Yeah. Isn't that a really good point? The number of people, because I've worked in private practice, and a lot of people sometimes come going, I'm just feeling like this, but I'm really have no idea. And trying to work through what the actual problem, assess what the actual problem is, can take a while. Whereas someone who's gone through a process and looked at tracked their symptoms, in these digital mental health spaces, and got a bit of an understanding of what they're going through, coming to a psychologist with that information, already armed with that information, can then really speed up the process. You can, hit the ground running.
Make you therapy ready, I think.
Yeah.
Just
I
give you a
love it.
bit of insight. Yeah. And I mean, one of the ways that, for example, I mean, it's been studied in trials, but one of the ways these programs can be used is for wait lists. So while you have clients who actually, they're waiting to see, you've got a long wait list, you want to be able to offer something, these can be the kind of programs that are really effective for exactly the reason you just mentioned. Yeah.
Kylie, can you tell me the difference between moodgym and eCouch for our listeners who might not be familiar with them?
Yeah, absolutely. There is actually quite a big difference, and we probably don't explain it well. So as I meant, there really are an iteration of each other, but moodgym is a very linear, structured program, originally designed for young people. It's got 5 modules and you have to complete them in order. And it really jumps in pretty fast with kind of some cognitive therapy learnings and teaching. So it gets straight into things, and is really designed to help young people understand that feelings of depression and anxiety can be helped. And the whole motto of moodgym is what you think is what you feel. So it's really about that your thoughts can influence your feelings, and that's taken through the program. eCouch, on the other hand, as I mentioned, it was actually designed for adults. So it has less of that young people vibe about it for sure. But it also, it's much more comprehensive in that it has programs for depression, for generalized anxiety, for social anxiety, and also modules for bereavement and loss, and for divorce and separation, because those latter two are really high risk factors for developing depression. And within each of those programs, there's not only sections on, for example, cognitive behaviour therapy, interpersonal psychotherapy, different evidence-based techniques for each. There's also an information module which has really clear mental health literacy information about that disorder. So it's very much disorder-based, and really trying to demonstrate the different therapies that you can learn skills and that have been shown to be effective. So one way that, for example, eCouch can be used by a practitioner is to actually encourage someone to explore the modules and think about which kind of techniques might actually resonate best with them. So, for example, not every kind of technique is going to work for you, doesn't land properly with you, but you can get a really good oversight of the kind of ways you can deal with different kind of symptoms. And there's also no harm in, I think it's anxiety I'm feeling, but learning more about depression at the same time, or about social anxiety and those different disorders. So eCouch is much less structured. You can really choose your own adventure,
pick and choose.
Yeah, and there's no kind of end point. It's always there as different modules to explore.
So it's not it's not linear like moodgym is. You can kind of go in and go, oh, I might want to try this. And now you said there's a range of different kinds of strategies in there. So we're talking like behavioral, cognitive. Is there mindfulness in there?
Yeah, there is. So under the relaxation modules, exactly that. There's also, for example, within the social anxiety program, there'll be exposure therapy and attention practice. So different techniques that kind of land with different people at different times. Yeah.
Is there anything in there? I'm not sure I mean, you'd have to know a lot about the other programs in this space. Do you happen to know if there's anything in eCouch that makes it, in terms of the kinds of strategies in there and approaches, that makes it unique from other programs in this space?
I can't tell you definitively, on that point, but my feeling is that it's the overview that you get, and the choice and the choose your own adventure kind of aspect of it is quite unique.
That it's not taking it, lesson 1 this week and lesson 2 this week. You've got a bit more flexibility.
Exactly, which for some people doesn't suit them, of course. And some users really prefer the moodgym. Okay, you've got to get this module done before you move to the next. But other users really do like the fact that they can find what it is that they want to learn and practice that. Yeah.
And I imagine that would be really quite appealing to practitioners as well, who might want to use it with patients and clients, where they can just go into the program and pick and choose something rather than having to, try and click through a linear program. They can just go in. Yeah.
So unlike other programs, we don't have, for example, a practitioner portal. So you can't go in and assign modules or anything like that. We really have a user-first model of this is for the user and no one else has access to that data. However, exactly that. You can have a look, decide, okay, I really want this person to have a look at, the interpersonal psychotherapy stuff and have a look at that. I'm going to prescribe that for them, and we're going to talk about it at our next session. So that's one way of using the program as a kind of an adjunct to your own practice as well.
Can you tell us a little bit more about the interpersonal psychotherapy kind of aspects? Because I think that is something that is unique, that some other programs don't necessarily incorporate.
Yeah. I mean, so this is in the depression program, and iPT, as it's shortened to, is an evidence-based treatment for depression. So that's one of the reasons it's in there. Nothing is in the modules that hasn't got a high evidence base. And it's really, I found it fascinating. I knew nothing about it. You probably do, Tanya, but I didn't know anything about the approach. But it really focuses on your role and your relationships, and how your roles might change over time, and the fact that you need to change, deal with changing roles. You might grieve about different roles. For example, if you go from being, always being a mother to going back to work, for example, that could be a role change. And it's a really interesting way of looking at it. And I actually, CBT did change my life. But then once I, got over that, I realized that for me particularly, this made a lot more sense to focus on actual relationships and my roles within them. So it's just another way of looking at how your emotions may manifest that a lot of people may not have thought of before.
Yeah. And I think you mentioned that the specific kind of programs or courses within eCouch on grief and bereavement and divorce and separation, I guess would incorporate a lot of that role transition information as well, which to my knowledge there's not a whole lot out there, especially not in the I guess the kind of treatment program space. There's information websites, there's some helplines for those particular issues, but there's not as much out there as there is for, say, depression and anxiety. So I think a lot of people will find that appealing.
And it was written, especially the grief module, it was written by Kathy Griffiths, but also Georgia Taylor, who's a very experienced clinician. And it's funny, I know that content inside out. And yet when my dog died, like last year, I found myself incredibly, grieving. And I actually went back and just couldn't believe how useful it was at that time to just reread the strategies, to understand, the different techniques I could use, and really just to get a sense that my grief was okay, and to how to kind of place it. So I think we often underestimate grief and how it can really impact ourselves when it isn't necessarily conventional. So I really like the fact that our grief program is there with our other programs, and is something that anyone can actually explore.
And it makes it really useful for, this is not just for people with diagnosable mental health disorders. This is not pathologizing, normal experiences. This is, here's some material that actually can help us all cope and work through human experiences that are painful and difficult, this is information and stuff that can make it easier for us. So it does, make these things useful for, there's a place for, there's something for everybody really,
Exactly.
at most people will go through an experience like that at some point. And something I mentioned at the top of the program, and that you kind of spoke to a little bit, but I'd like to dive into it a little bit more, is just how long the eHub programs have been around for. What else have you learned along the way about, what works, what doesn't work, what people like, what people don't like?
Yeah, so it's really interesting. I think that one of the things I've learned is that people are different, right? What one person likes is exactly the same thing that somebody else doesn't like. So we have huge numbers. We have up to about 30,000 users a year from Australia. So we get a lot of feedback and a lot of opinions, and it's, which is fabulous. We very much encourage our service users to provide feedback and share their experiences. But I guess it's really that thing of, some people love the structure of moodgym. Some people hate the structure of moodgym and say, well, why can't I go wherever I want? And then we're kind of like, oh, you're right, but you might like to try eCouch. Some people come to eCouch and they hate the fact that they're, well, what am I meant to do? And and other people find that really useful. I think probably the biggest learning has been just how timeless a lot of the teachings are, the training. The fact that if there is obviously, if there was suddenly evidence that CBT doesn't work and is dangerous, our program would change. But ostensibly, the program is the same. It looks different, but we haven't made major changes to the content because it has a huge evidence base. It's been highly researched and it's been shown to work in so many different contexts. So, that could be surprising, in terms of technology, but when you think about it, it's just the content. It's really that content doesn't need to change necessarily over time, but even more so, it doesn't necessarily have to continue to be tailored to different groups. And that's been really interesting. Certainly, if we had heaps of funding, I can't imagine a world where I'd be like, oh, okay, so can we make, a moodgym for this age group and this age group, and but in the end, when you're talking about a population-wide program, actually it's very cost effective to do a program that is targeted at the whole population and it still works. So that's probably been the biggest learning of all. I think the other things that people do, sorry.
I was going to just add that really makes sense to me, again, using the physical health analogy, because yes, prescribing, say, exercise for kids versus teens versus adults versus older adults, you're not going to be prescribing the same exercises. It's going to be, very different, but promoting exercise as a population, level, get active in whatever way works for you, is tremendously helpful and effective. So it seems like that's kind of the parallel here with the kind of skills that moodgym teaches.
Yeah, exactly. I think that's right. I think another learning is that it's hard to do self-help. It's hard to stick it out. So there's huge drop-off with our programs. People don't complete massive amounts of it, and that's okay. But the thing about programs like these is that they're there when people need them. They're there for people to do as much or as little as they want to do. If somebody leaves the program, it could be because they've got what they need, but it could also be that they've understood how they're feeling and they're ready to access other help. So I guess this comes back to the place of these kind of programs in the spectrum of mental health services as well. These aren't necessarily programs where you say, if you haven't completed the treatment protocol, it's a failure. That's really not how they operate. It's more the fact that they're there to be accessed. And if somebody comes and they click on it and they start reading some information, that is the win here. So I think there's really another key learning is becoming very clear about where these programs do and don't fit, especially now we have so many more services available, which is fantastic, because some people really, want clinician guidance. They really want that, somebody else to help them through, and that's fine. We have other services now which can provide that, which is terrific.
Yeah, and we face the same problems in face-to-face care. Dropout rates are, really high. So it's not like it's a problem that's unique to the digital space. And I think what you mentioned before is a really good point, that people are different. We find this in face-to-face care as well. Some people come in and they want all the worksheets and they want the practical, just tell me what to do, just give me a strategy, I'll go away and practice it. And some people go, I don't want that. I just want to talk this out. I need to make sense of what's going on here. And you don't know that until they walk through the door and you work it out with them. And that doesn't mean that the therapy you're doing is not, you might be, the most fabulous ACT practitioner ever, but that's not going to work with someone who doesn't want to do that.
Exactly. Yeah, really good point. Yeah.
So I think your point's really valid there, that those services are there for the people that want them, for whom that works for. They're there. And likewise, there's so much popping up in this space that there'll be something else that might suit them better, or face-to-face might suit them better, or something else entirely. It's another option for people to find what they need.
Absolutely. And I think that's terrific. Like, choice is the goal here. I think that's what's been missing in mental health services. But, I think the more we can empower people to choose services that are relevant to them, and to do that, you need information and you need knowledge.
Yes, absolutely. And I think, as us as health practitioners, reminding people of that and saying, it's okay, it really comes down to what works for you. If you go on and try this and it doesn't, that's actually okay. Cool. Yeah. That. Try something else. That doesn't mean you're a failure and it should have worked and, be better. It means, okay, that wasn't for you. Try something else. That's totally okay. I think there's this, expectation in psychology that, this is the treatment and it should work. Same with face-to-face, that, I came and I saw someone and it didn't really work for me. That doesn't mean you're broken and it's never going to work. Try something else.
Exactly.
Yeah. Oh, well, that's just about all we have time for today. Thank you so much, Kylie. I've really learned so much from you today. And I think that, knowing the rich history behind these programs and where they came from, and that, that story of evolution really helps build trust in them, especially for those who are completely new to digital mental health, that whether that's the practitioners recommending them or the clients themselves. So I think it really helps to build that trust and also that, motivation to go, oh, wow, this could really help me. This could really help my clients. So I'm really glad we were able to cover a lot of that today. Thanks so much for your time.
Thank you so much. And, wonderful podcast. It's so good to be getting the message out about e-mental health to so many practitioners.
Fabulous. Thanks so much, Kylie.
Thank you.
Bye.